So a lot of people ask, can I get every single tooth replaced with an implant? And the answer, of course, is yes. There are several different options for that. And for people who get several opinions, because it's a lot of teeth, so it's not uncommon that people will come in after seeing many different people, dentists, and they'll say, well, one person has, their treatments were one implant for a tooth. Do you do that? Yes. Some people had maybe one implant like every other tooth and to do 3-unit bridges, and that's another way as well. Very nice way to do it. Much like having your very own teeth, both of those. And then some people say, gee, that turned out to be quite expensive. What are some other options? And a very popular one right now is a screw retained teeth option. So I think that's kind of hit the prevalence of what the dental marketplace is doing right now. So with that, I have pulled out a few of those options. One is a very reasonable option, and that these options fall into two separate categories. One is fixed, like your own natural teeth, and the other is removable with a fixed component to it that feels like it's fixed. But you can remove it at home and clean it, or if it's screw retained, the dentist can remove it to clean it. And so with that removable option, which are typically made out of acrylics versus crown and bridge materials like porcelains fused to metals, zirconias, very hard materials that are thin and light and strong, and they last a long time. The acrylics are a plastic, so they have sometimes little teeth will come off just like a denture, and that we can send that off to get replaced. But this is an example of a kind of a nice entry level place for people who might say, gee, I really can't afford the full arch, every implant per tooth. And so a lot of times you can get perhaps 4 implants to support a whole arch of teeth. And this is a very good example, a rock solid example of something like that on the lower arch and lower jaw. And so this is 4 implants with a bar, and then the denture will clip to this bar, and it sits on the bar to gain stability, where it won't rock, support, where it's not pressing on the gums when you chew, and retention, so it doesn't pop up when you eat. So it provides a very good surface to chew upon, much better than if you're wearing a denture and it's hitting your gums all the time. So this provides a feeling like it's your own natural teeth, and that it doesn't hit the gum. It's retentive, they don't pull up, and so it's supportive, retentive, and stable in 3 dimensions. And then some people say, well, gee, this is kind of expensive too. What are some other options? And then a more entry level, it's very, very good. These are both very good. And then, of course, there's some that are very better. And then, the very, very best ones are just an implant per tooth. So if you go from good to better to best, a very good option is an implant-supported replacement teeth with acrylic. And there's a lot of different snap sort of attachments. The most popular one right now is probably the locator attachment. And you can just, like on the lower, if you just get even 2 implants, that'll provide retention so that your teeth just don't lift up, your denture just doesn't lift up, and it takes the place of adhesives. So it's very good for providing retention. I think some of the issues that people experience with that are if you only have 2 of them, then let's just say you've got these 2 here, implants, because, just couldn't afford the whole 4, and, so it's very good. Get your toe in the water, get some nice retention. But as far as stability goes, if you think of an axis on these 2 implants, that the teeth might tend to rotate a little bit. So there might be a little bit of, rotational motion upon those 2 implants. And so a lot of times if you need more stability than that, then we can add 1 or maybe even 2 more. And if you have 3, then it'll be more stable, like a tripod. And if you have 4, it'll be even more stable, like a chair or a table. So those are some fabulous different options for full arch implant supported and retained teeth.